fatty liver, which simply means fat in the liver. Liver is an organ where fat should not be there. But this condition, it's it's growing. I mean, a lot of people have it and they don't even know because it comes without any signs and symptoms. We have a gastroenterologist and hepatologist here who is going to talk to us about fatty liver and various things about it. And so I have Dr. Raja Sapati. He is a practicing gastroenterologist with the GI Specialists of Georgia. He works in Aqua, Georgia. Raja, can you introduce yourself?
Yes, hi Nandini. I'm Raja Sapati. I am actually a board certified doctor in internal medicine, gastroenterology, and hepatology. And I practice in field of gastroenterology and hepatology in Ackworth, Georgia. I'm part of GI Specialists of Georgia, which is a private gastroenterology group.
Thanks for introducing yourself, Raja. And this fatty liver, I mean, I'm a primary care physician and obesity physician. I've been seeing a lot of patients these days with no signs and symptoms, but coming with fatty liver So can you tell us a little bit about what is the incidence of fatty liver these days?
Good question, Nandini. Actually, with the obesity epidemic, fatty liver by definition means fat in the liver, as you mentioned. Fatty liver can be caused by multiple different etiologies or the reasons. It could be alcohol related, which is more commonly known, and non-alcohol related. So alcohol related disease also leads to fat being stored in the liver. Similarly, when you say non-alcoholic, that means the person or the patient has never is not on a regular basis does not consume alcohol. And even there's an entity called as non-alcoholic fatty liver disease, or NAFLD. This constitutes pretty much a major problem right now in US as well as across the world, as obesity epidemic is increasing. If you can, in the numbers wise, you can take at least 20% or more of the population does have fatty liver disease. Then there is a subset of fatty liver disease, especially in Southeast Asians, called as fatty liver disease in lean individuals. This is a different kind of, it's a different subset. This is about 7 to 14%, almost 14%, 15% of the population.
Right. And I'm glad you're mentioning the numbers, Raja, because most of the time, we call high blood pressure as silent killer, but most of the time, fatty liver has become one of the major silent killer these days, because a lot of people, they don't have any signs and symptoms, and all of a sudden we check the labs and they have elevated liver enzymes. Could you tell us a little bit more about these signs and symptoms and what to watch for when patients get elevated liver numbers?
Good question. Actually, there are, as such, no signs and symptoms of fatty liver disease. We diagnose it because of certain, some persons having abdominal pain, and we do an ultrasound to see why the pain is, or a CT scan that may show fat in the liver, and then we diagnose, okay, there is fatty liver in your case. Similarly, sometimes patients may come from routine, when they do the routine labs, they have elevation in their liver numbers. And as a part of elevation in liver values, the patients then refer to us. And then when we go further and delve into the subject and do more testing, that's when we realize that that the patient may be having fatty liver. And then confirmation, the best confirmation would be doing a liver biopsy to see what is the fat doing to the liver. But This fatty liver disease is actually a spectrum of disease. So it can be just plain fat in the liver, where it takes long time for the fat to cause inflammation, leading to fibrosis, which is healing mechanism, or and then fibrosis later on, leading into injury pathway into cirrhosis, which is a irreversible form of liver damage. That's the stage 4. So people can be found in different spectrums of in different areas of the spectrum, being plain fat in the liver with no elevation in liver test, fat in the liver with elevation in the liver test, then biopsies proving different stages of fatty liver, and finally leading to cirrhosis in the liver.
Yeah, Raja, could you tell us more about the cirrhosis of liver and why do we have to worry about and why is it a major thing?
Cirrhosis is like end stage of liver disease. Liver is very central in our functioning. It does a lot of functions, and it's almost the biggest or largest organ in our body, weight wise. Taking away the GI system, but the liver itself is a very large organ, which is in the right side under the rib cage. So it does various functions. It maintains your level of body fluids. It maintains how your blood is, how much the blood can be thin or thick. Basically, it makes proteins required for the body. So once you do not have proteins, then it affects your overall functioning. And actually, liver cirrhosis, there is no treatment as such. Liver transplantation is the only treatment as such for the liver cirrhosis. Cirrhosis means it's an irreversible damage. People can still function with a cirrhotic liver, but they have higher chance of decompensation, which is going. They can be easily in trouble, be it because of lack of immunity, lack of protein in the body. And indeed, if somebody has liver cirrhosis, liver transplantation is the only chance of survival. And in Georgia, there are 2 institutes which are which do the transplantation, are in Piedmont as well as Emory. That's it.
And Raja, I'm glad you mentioned about the liver transplantation, and the list is huge. I mean, it's not that like you're listed for liver transplant and you're going to get it. So, alcoholic liver disease, we all know about it, but like there is a silent epidemic of non-alcoholic fatty liver
Yes.
disease, and that's caused by unhealthy lifestyle.
Yes.
Could you tell us more about like what causes this non-alcoholic fatty liver disease?
So basically, like whatever we eat and drink goes through the liver. So if I always tell my patients, whatever we eat, it's converted into glucose, and liver stores the glucose. Now, if we do not use it, then there is increased uptake of glucose by the liver, making storing it in the form of fat. And over time, this starts to affect the liver functioning, causing inflammation leading to fibrosis, which is a repair pathway. It can either repair it to get normal, or repair it and further worsen inflammation and become fibrotic and cirrhotic at the end. That's it.
Yeah. What are the lifestyle changes you recommend? When because it's different when we see the fatty liver disease in South Asian population where they're lean individuals, but they do have fatty liver, and when we see the other end of the spectrum where they are we have the obese individuals and they have the fatty liver. So once they start losing the weight and following a healthy lifestyle, there is a chance. Is there a chance of recovery?
Yes, definitely. There's always a chance of recovery in liver up until it becomes cirrhotic. Liver is the only organ which can forgive you for whatever we do. As you mentioned, alcoholic liver disease is also a spectrum. So if they quit drinking alcohol, there is a chance that they can revert back the liver can revert back to normal. In regards to the non-alcoholic fatty liver disease, you can see a typical spectrum of problems in a patient. Usually they are obese, they have high blood pressure, they have diabetes, they have dyslipidemia, they have hypothyroidism. So these are all kind of mentioned in what we call as a syndrome X. And as I mentioned previously, you see lean individuals. There's more interest being generated in evaluating the presence of fatty liver disease in lean individuals. So lean in the sense, the definition is if the BMI is less than 23 to less than 25. Typically, this is found in people from Southeast Asian descent, especially India, Pakistan, and Bangladesh and Southeast Asia population. So here, you don't see a typical spectrum of person being obese. They are very lean, but still they do have insulin resistance. They have dyslipidemia and bad lifestyles such as sedentary lifestyle without much exercise and muscle, lack of muscle in the body.
Yeah. So yeah, mainly these kind of patients, they store more visceral fat. So I mean that I think like mainly the visceral fat is the main problem. So then compared to the fat all over the body, they store more of abdominal obesity and visceral fat. Yeah, that's the main problem with these individuals. So yeah, definitely lifestyle changes are the main thing in the initial stages.
Yeah, as you mentioned, the lifestyle changes, like, the visceral fats, sedentary lifestyle. So even the muscle mass we consider muscle mass like to be low in people from Southeast Asia, possibly genetic versus, lack of exercise too. When you do exercise, the muscles actually also take part in the glucose metabolism in the body. And in that way, the liver has less to deal with and store the glucose in the form of glycogen. So in that way, you're able to divert the nutrients from liver to the usage in the muscles. And that is one way of countering the non-alcoholic fatty liver disease.
Right, yeah. Whenever we talk about exercise, people only think about like running on the treadmill, but like strength training exercises are the must for this reason. Like mainly strength training exercises help to build the lean body mass, which help with the insulin resistance. And like how Dr. Raja told about like how the muscles can combat the other things, other damage which can happen with the liver. So yeah, definitely that's one of the reason. Yeah, any other advices you want to give to our audience, Raja?
Yeah, basically, like, getting back to your primary doctor and making sure you're being measured for the insulin resistance and checking your lipids, which is fat, which is cholesterol, making sure you're on treatment if you do have, abnormal lipid profile, and increasing your physical activity and physical strength, thereby preventing preventing development of diabetes. As you mentioned, ultrasound is one of the most benign exam. It's not an interventional exam. Ultrasound, you can get a ultrasound of your liver to see if there is any observation of fat in the liver, and then trying to change the lifestyle, which is in our hands more so than the doctor's hand. And limiting alcohol consumption, limiting carbohydrate rich diet should be the way to go.
Yeah, especially the processed carbohydrates like rice and pasta and all those things, like they can elevate the triglycerides and even that can cause fatty liver. So yeah, healthy lifestyle is a key. Thank you so much, Raja, for sharing all this information. And it's been a wonderful session. And if you like this video, please do share it. And don't forget to subscribe to my channel, Stylia Health MD. Thank you.